our unit we can have up to 4 patients. We get everything from respiratory kids to GI kids, neuro, we see it all up on our floor. So we have 2 pediatric teams that we work with, mostly the red team and the blue team, which are residents and doctors. And then we work closely with respiratory therapy as well as our CTAs. So for us on the 8th floor to be able to keep up with the new procedures and all the new skill sets that you'll need, we have classes that we do periodically throughout the year, some that are provided like just based on our floor, like the patients we see, and some that are hospital-wide. They also have opportunities where you can get scholarships to go to different like classes or different seminars and learn all different kinds of things that way as well.
So we see a lot of patients with medical diagnoses. Our biggest one is respiratory, so patients that come in with asthma exacerbations or with viral illnesses like RSV, rhinoenterro. We had a lot of COVID patients the last couple of years, and so we see a lot of patients that need respiratory support. We also care for patients that have failure to thrive or hyperbiliary, so we have a lot of babies on our unit. And we have GI patients and non-accidental trauma. It's actually the breadth is pretty wide, and the nurses get to know a lot about a lot of varieties of illnesses, disease processes. So whenever there are new nurses that haven't seen some of those patients before, they do rely on their team members with more experience to help them understand, troubleshoot things or give them advice on how to best care for their patient in a way that will help them get better. So that is watching nurses come in and have all these questions, then learn to master that by relying on their team members and their experiences, talking to the physicians, the residents and attendings, as well as their nursing peers, their respiratory therapy partners. We get to see them grow, then they become that person who is a resource for the next round of new nurses. My job is to figure out, do the nurses have everything they need to give the best patient care that they can? We spend time on education programs, recruitment efforts, recognition and rewards for staff so that they feel valued and want to stay and keep their experience here, which is ultimately better for the patients.
I'm in kind of a unique position. So I worked as a tech here while I was in nursing school, and then I came on as a new grad onto my unit and have now been here almost 4 years. And so I have that very specific experience of, coming on and being scared and new and feeling like I don't know much, and especially coming onto a unit that was a little bit daunting because it does cover so much. I think I was a little bit nervous at first, but I was so well prepared and set up for success by my coworkers, by my bosses, by my leadership, and they did a really, really good job of teaching me on a day-to-day basis. And I think there's not an expectation of having to have it all together right when you start. And I had a really great preceptor, and I had a lot of nurses I look up to that were so quick to be so helpful and teach me so many things. And I also think that I learn, like I said, every time I go into work. And so that is also something I really love about my unit, is that I'm now 3-4 years in and I'm still constantly learning. And so I feel like I've gained such a wide skill set, and that the unit that I work on has not limited me at all, because I do see a lot of different things, but I am also constantly learning, which is really great.